Welcome to another episode of Healthy Living. Today I'll be talking on meningitis. Meningitis is an inflammation of the membrane surrounding your brain and spinal cord. The swelling from meningitis typically triggers symptoms such as headache, fever, and a stiff neck. Some cases of meningitis improve without treatment in a few weeks. Others can be life-threatening and require emergency antibiotic treatment. Possible signs and symptoms in anyone older than the age of 2 include sudden high fever, stiff neck, severe headache that seems different than normal headache with nausea or vomiting, confusion or difficulty concentrating, sensitivity to light, no appetite or thirst, skin rash. Infants with meningitis may be difficult to comfort and may even cry harder when down with high fever. Seek immediate medical care if you or someone in your family has meningitis symptoms. Bacterial meningitis is serious and fatal within days without prompt antibiotic treatment. Delayed treatment increases the risk of permanent brain damage or death. It's also important to talk to your doctor if a family member or someone you work with has meningitis. You may need to take medications to prevent getting the infection. Viral infections are the most common causes of meningitis, followed by bacterial infections and rarely fungal infections. Meningitis can also result from non-infectious causes such as chemical reactions, drug allergies, and some types of cancer and inflammatory diseases such as sarcoidosis. Skipping vaccinations. Risk rises for anyone who hasn't completed the recommended childhood or adult vaccination schedule. Age. Most cases of viral meningitis occur in children younger than the age of 5. Bacterial meningitis is common in those under the age of 20. Living in a community setting. College students living in dormitories, personnel on military bases, and children in boarding schools and childcare facilities are at greater risk of meningococcal meningitis. This is probably because the bacterium is spread by the respiratory route and spreads quickly through large groups. Pregnancy increases the risk of listeriosis, an inflammation caused by Listeria bacteria, which may also cause meningitis. Listeriosis increases the risk of miscarriage, stillbirth, and premature delivery. Compromised immune system, AIDS, alcoholism, diabetes, use of immunosuppressant drugs, and other factors that affect your immune system also make you more susceptible to meningitis. Having your spleen removed also increases your risk, and anyone without a spleen should get vaccinated to minimize that risk. Meningitis complications can be severe. The longer you or your child has the disease without treatment, the greater the risk of seizures and permanent neurological damage, including hearing loss, memory difficulty, learning disabilities, brain damage, kidney failure, shock, death. With prompt treatment, even patients with severe meningitis can have good recovery. These steps can help prevent meningitis. Wash your hands. Careful hand washing helps prevent the spread of germs. Teach children to wash their hands often, especially before eating and after using the toilet. Spending time in a crowded public place or petting animals. Show them how to vigorously and thoroughly wash and rinse their hands. Practice good hygiene. Don't share drinks, foods, straws, eating utensils, lip balms, or toothbrushes with anyone else. Stay healthy. Maintain your immune systems by getting enough rest, exercising regularly, and eating a healthy diet with plenty of fresh fruits, vegetables, and whole grain. Cover your mouth. When you need to cough or sneeze, be sure to cover your mouth and nose. If you're pregnant, take care with food. Reduce your risk of listeriosis by cooking meat, including hot dogs and deli. Seek immediate medical care if you suspect that someone has meningitis. Early treatment of bacterial meningitis can prevent serious complications. That's the much we have for you on Healthy Living today. Hope you have learned from the topic. Join us tomorrow for another interesting episode.